Alright, Nisha the PA, we are live.
Hey guys, it's Nisha the PA over here at Dr. Emer's office, and today I want to show you a little bit about my gorgeous patient just one day post-op. First, let me go a little bit into his before photos before we get into his after. You can see he already had a well-defined chest, but he wanted to be just a little bit more well-defined. We also want to give him more definition to his abdomen, and then I'm going to show you a little bit of his other befores from the 45-degree angle, a little bit more definition he desired, and then to his calves. You guys have seen us do this before, where we've added more definition to the calves to give that more athletic look. Now, let's get into the after. Remember, this is just post-op. So we were able to do fat grafting to the calf. And then if we go up, look at his abs. One day post-op. This is fat grafting. This is also liposuction and internal heating with Renuvion, where we're able to sculpt out the abs and give him that super well-defined look. You guys can count the abs along with me, but they're all 6 of them are there, if not a little bit more. And remember, this is one day post-op, so his results will just continue to get better. So liposuction to the abdomen, fat grafting, also internal heating with Renuvion. Now look at his chest. First of all, look at the before. It was pretty well defined, but he wanted to be a little bit more well defined on the top region and a little bit less bulkiness on the bottom region of his chest. So we were able to accomplish that by doing fat grafting to his chest. We also did a little bit of nipple lift and gland removal. Remember, the reason why we do the gland removal is because we can't actually remove the gland through liposuction, so we have to manually do that and then lift the nipples to the correct position. So look how well defined he looks one day post-op after, and then look at his before. So super nice looking. Everything just kind of looks very defined, very athletic, very nice from the top half of his chest all the way down to his calves. Now I want you to also take a look at his arms, because we were also able to sculpt out his arms, give him a nice well-defined look by doing fat grafting to the correct areas and taking other areas with Renuvion to give him very athletic arms. So overall, very well defined. Now, I always tell only one day post, so his results always improve. You always want to give it a few weeks, if not 3 to 6 months, to see the final results. But this is one day post-op with swelling and everything else. Now, one of the reasons he was able to accomplish this is because we're doing the correct aftercare. And I can't quite show you guys right now because he's sitting down, but we were able to sculpt out the back of his, the lower back area, to give him a nice defined look here. You guys will see more as we continue to follow him along his aftercare. As he continues to heal, we'll be able to show you a little bit more of his back area and show you how we were able to define that area. But one more time, look at the before. Fat grafting, nipple lift, gland removal to the chest, to the abdomen. We were able to do liposuction, internal heating with Renuvion, really sculpt out his abs. And then if we go down to his calves, we were able to do fat and give him a nice, well-defined look. So everything just looks really amazing all together. Now, after we do a procedure, we always recommend that you do the appropriate aftercare. Remember, that's going to involve 3 different things. It's going to make sure you do IV hydration. It's going to be lymphatic massages where we express all of the excess fluid from the body. Remember, that is super, super important. It deals with infection, risk of hyperbaric. One of the reasons why all of our patients do so well after surgery is because they're dedicated to the process from the very beginning all the way to the end and making sure that they heal correctly. Now, it doesn't just stop with aftercare. I always recommend, to get the best results 2 weeks later, you can start to do treatments that will further enhance your results. You guys have heard before, but it's been a while. Number one, we're going to Venus Legacy, which is going to help to further in the area. And then we also recommend that you do True Sculpt Flex, which you can do almost on any part of your body that you want more definition. True Sculpt Flex is going to help to stimulate the muscle, it replicates 20,000 reps. You can't get that kind of work in the gym. You could try, but it's very difficult. And that's going to help to further enhance all of his results. Starting at 3 weeks post-op is when we start to do our laser treatments to all of our surgical scars. We want to make sure that all these scars are very minimal, that no one can notice anything was done, and you have this very athletic, refined look. Now remember, we can tailor the results to you depending on what you want. Right here, we have a very athletic, very well defined. But if you just want to look a little bit more lean, depending on what you want, we can cater the results to you. Now, each person is completely different. So if you guys want a consultation to see what's going to work best for your body type, what's going to work best for your goals, you guys know how to reach out to us. You can call us, you can DM us, and we will reach out to you. We'll set up a virtual or in-office consultation, and we will get you ready by next summer. If you want to be ready by next summer, you got to come in now and get the work done, guys. Now, once again, I'm going to go over the few things he had done. Remember, to the chest area, we did fat grafting, nipple lift, gland removal. To the arms, we also did fat grafting and internal heating with Renuvion to give them a nice, well-defined athletic look. To the abdomen, liposuction, we did the sculpting, and then we also did internal heating with Renuvion. Remember, it's super important, the internal heating with Renuvion, because it's going to shrink wrap the skin to the abs and get you a better defined look. And then if we move down to the calves, remember we did fat grafting here. We're going to shrink wrap that skin, get him nice and tight. Now, if you guys have any questions, make sure you reach out to us. The PA over here at Dr. Emer's office. And until next time, I'll see you guys then. Bye, guys.